This is Nathan Radcliffe, and welcome to Interventional Mindset. This is the art of glaucoma management as seen from the eyes of the interventionalist. As you know, in glaucoma management, over the past 10 years, we have seen a renaissance of sorts with a major area of unmet need being filled with microincisional glaucoma surgery and the expansion of laser. We've always had three pillars of glaucoma therapy: eye drops, laser, and glaucoma surgery. And there's been a bit of a gap between laser and glaucoma surgery where we had the need for more efficacious but exceptionally safe surgeries. Microincisional glaucoma surgery has come in to fill this gap, but we also now have a fourth pillar of sustained therapeutic delivery of glaucoma medications. The problem, however, is that our culture is into pharmaceutical therapy in general, and that there's a natural tendency for patients to push back when offered an interventional therapy. The reason for this is that there are psychological principles at work that help patients cling to the status quo in the reversible aspect, or the perception of reversibility, with pharmaceutical therapies. Primarily, if we are to bring our patients forth into the interventional era, we need to recognize their psychology and we need to address it. For me, the first aspect of this is recognizing that no one would want to have any type of procedure at all if they could avoid it. This means that no one would want to have a laser, a surgery, even a safe surgery. But unfortunately, with glaucoma, that's just not the case. We need to remind our patients that when you have glaucoma, it is irreversible, it is progressive, and it can lead to blindness. Furthermore, we need to remind our patients that not everyone can be adequately treated with drops, that most patients on drops do progress and get worse over time, and that our patients have side effects in many cases to eye drops that are affecting their quality of life. So we need to reset our patients' base expectations and help them understand that in many cases, interventional approaches will solve their problems and make their life better. And this leads me to my second point, is that when we are approaching a patient with a suggested or recommended intervention, we need to tie it to that patient's life and to the complaints that they have brought to us. When I meet most of my patients in the office and ask them how their eyes are doing, they will tell me a variety of things, often complaints that are side effects of eye drops. This may be eye redness, eye irritation, eye discomfort, or fluctuating vision. I also have a lot of patients who tell me that they're forgetting their drops, or they'll make up excuses for why they haven't used them recently. They'll complain about cost and running out of medications at the end of each month. When I make a recommendation for an intervention, I really focus on tying my recommendation to the patient's problem. I let the patient know that I perceive their problem to be caused by the nature of eye drops or problems related to eye drops, side effects, and I explain how my intervention is going to solve that problem for them and improve the quality of their life. One thing that can help any of us bring a patient to a therapy we feel is best for them is truly believing in the therapy, and part of that is using these therapies at the right time. My own personal journey with laser trabeculoplasty taught me that when I used laser earlier, I had better results. As I used laser earlier, my confidence in laser, my understanding of what it could do for patients grew, and I then began to share that confidence with patients who picked up on it immediately. My belief in the therapy is what gave them the confidence. And we all know this because anyone who's done laser iridotomy knows that if you see a patient who has angle closure, iridotrabecular apposition, you always are able to get that patient to have a laser iridotomy. Why? Because you believe in the therapy. You're convinced that that's the right treatment for that problem. And patients can feel that, and that's why they go ahead, and they're better off for it because they're getting the treatment they really need. So we want to bring our beliefs and our convictions to the patients if in fact we do believe in a therapy. Another aspect of this is recognizing that for many of these interventions, there are many different candidate types. We want to find the right candidates, but we also want to keep an open-minded approach towards who are the best candidates, recognizing that we can now tailor therapy to individual patients, and that many different patients, for many different reasons, will benefit from an interventional approach. I therefore turn it around not to say who are the patients who can benefit from these interventions, but saying, are we as doctors doing all that we can do to become interventional specialists? And on the glaucoma side of interventional mindset, we'll explore those issues and we'll talk about ways that we can bring the best level of care to our patients through an interventional mindset. Thank you very much for listening.